So let's get started. We're probably going to be about, I'd say a little over an hour or whatever to kind of go through everything and just give everybody. And if anybody has any questions as I'm going through, just, please either you can stop me as we're going through the presentation, or at the bottom of the panel for the people that are logged in individually, you can always type your questions in the bottom of the panel down in the chat section, and then I kind of can come around and circle back to them at the end or whatever. So it's ever easier for everybody. That's how we can do it. So, so basically, what you're seeing on my screen right now is the what I call the public side, where the public actually goes to actually go and search for a clinic. And from there, what can happen is they can actually search any clinics that have been set up and then go in and schedule their particular appointment. But before we can get to that point for them to actually go in and schedule their appointment, what I'm going to do is I'm actually going to show you how to set up that clinic so the public can go in and actually select those clinics and see what clinics are available. So I'm going to pause there because, let's see, Justin says the call sounds muffled. I actually have two speakers around me. I'm not sure. I'm not sure if it's on your end. I'm hang up and dial back in. Maybe you guys can try to dial, hang up and dial back in, and I'll wait a minute.
Yes, Mark. Can we try that? We'll call back in and see if that clears it up.
Okay, sure. I'll wait a minute. Yeah, go ahead.
Thank you.
Nope. Okay, and we have other folks on the line, correct?
Yes.
Okay, Mark, we're back on.
Okay, good. That actually sounds a little bit, well, maybe not. Still coming in muffled.
Yeah, I don't know if it's our speaker system. I'm not exactly sure what's going on with this right now.
Can you put your phone on mute when I'm talking?
I sure can.
Let's try that. Maybe it's the background that's doing it. So if you have me on mute now, I'm not hearing a lot of background static like I was. And you could tell me if you hear me better now, and just take me off mute real quick. Justin, Frank?
Yes, we went on mute.
Okay, was it better when you were on mute or no?
It seemed that way, yes.
Okay, so why don't we do this, because I didn't hear all the background chatter that I hear now, so I think it might be your phone is kind of causing part of the problem. So why don't you keep me on mute as I'm going through, and then if you have any questions, if you want to type them in the chat section at the bottom there, then I can stop and answer your questions as we go along, if that works.
Will do. Sounds good.
Okay, good. Okay, so that being said, let's get started here. So the screen that I'm at now is going to be the screen that you're going to come to. Oh.
My screen.
I'm sorry?
The screen went out. Say username and password. He changed it. Okay. Somebody's not on mute.
Yeah, you should be seeing my screen.
Okay.
Okay. Okay. So this screen here where it says username and password, this is where you're actually going to first come into the system in order to set up your clinics, okay? So I'm going to log in as a user here. Okay. And when you first log into the system, okay, depending on what level of authority you have within the system, I'm logging as an administrator right now, but chances are your users, the regular users, will not see the security management section, which is fine. What you'll end up doing is coming over here to the immunization tracking section. Okay. So what we'll do is we'll click on that. Okay. And when we get to this screen here, the first thing that's displayed here is basically all the patient records. We give you or we present you with a patient search because most people are going into search. But where we're going to actually go into first today is we're going to go into clinic management. This is the area where we're actually going to go in and create our clinics and make sure our clinics are set up the right way. But before we can actually set that clinic up, there are a couple of other housekeeping items that I want to go over first to make sure that when we do go set up our clinic, those items are set up already, okay? And those happen to be, the first item that we want to make sure is manage clinic locations. Now, these should already be set up for Burlington County, but basically what it is every place that you're going to perform a clinic, we need to have that location set up in the system, okay? And basically that location gets set up by city. Now, again, I'm working in the Hackensack-Bergen County area because the Burlington County server wasn't responding, so I can't show you stuff down in that area. But what you would be presented here with is you'd be presented a list of all the towns in Burlington County, okay? If that location was previously used or a clinic was previously at that location, you will see the locations that previously were used in this list down below here, right? So I see, even those, most of these are all Hackensack, but I do see one Annandale here, okay? What you'll see then is you'll see the name of the location, right? So this one says Barcelona Court Hackensack Housing Authority. This one was the Hackensack Health Department. This was the Recreation Center. This was at the Housing Authority. So these were the different locations that clinics were performed within the town of Hackensack or Annandale. For you in Burlington County, I know you guys do clinics all around the county. You should see all the different towns and the different locations that those clinics were, along with their street address and information. Now, if there was a clinic that you're going to do for this year that isn't currently on the list, you can just simply add that to the list. So the first thing you would do is you would pick the city or the zip code that that town is going to be in. So I'll just pick Hackensack for right now. And then basically what you're going to do is you're going to give it a name, right? So I'll say this is, what's in Hackensack? Hackensack Mall, okay? Because there's the mall up there called Hackensack Mall. And I can give it a location. I can say it's Route 4 is the location. And then once I add that, I'm going to click on the little icon, the Save Disk icon, okay? And now what's going to happen, that's going to add it to my list. So now we see that Hackensack Mall has been added to my list of available locations. So that's one of the first things you want to check is to make sure that all your locations are available. If they're not, when I go to set up that clinic, if that location is not available, I won't be able to set up that clinic. I'll have to come back to this screen here and actually set up that location first. The other couple of items that we go through are, the next item that I would tell you to look at before you start to set up your clinics are your clinic questions, okay? Now, what we do on this screen here, these are all the different potential questions that you can ask to the patients when they go to register online for that particular clinic. Now, you don't have to use every single question when you set up your clinics. You can use the appropriate ones. Now, some of these we gave as part of the initial system design and rollout. Others were added. And you'll notice that on this screen, the questions are both in English and over to the right, they're in Spanish, okay? If you need to edit any of these questions, you would have to come in here and edit both the English version and the Spanish version if you wanted to change anything. If you wanted to add a brand new question to your question list, you would come up here, you would type the question in, and then you would also have to type it in Spanish as well. We do not have a conversion in the system to convert English to Spanish. So if you were going to have a new question, and you wanted it in Spanish as well, you would have to have somebody translate that and enter the text into this side here, and then add that question to the system. So again, most of the questions are pretty standard and fixed. You know, they've been used for several years now. But like I said, you know, I do know things that change from year to year. There might be a new question that, you know, the CDC is requiring you to ask now, or you've come up with a question you want to ask that's not currently in the list. You can come in here and you can add your new question at any point in time. So that's one other area you kind of want to review prior to setting up your clinics. The last item under, or the last two items under clinic management would be to, I'm going to go all the way to the bottom of the list to what we call map vaccines first, okay? And what we show here down at the bottom is the different vaccine names. So we have different clinic types, well, one clinic type here, which is called immunization clinic. But we can actually have different immunization clinics. We can have an adult flu clinic, we can have a high-dose clinic, we can have a pediatric clinic, we can have a pneumonia clinic, okay? We do have them listed down below already. You know, we have a couple of these here. But let's say I was going to set up this new clinic, right? We'll just say it's an adult clinic, okay? And I click on Save and Update, okay? Then now we've added that, or we've mapped immunization with that service type within the system. Again, these should already be set up for you, but again, I just wanted to show you that so you can actually come in here and take a look and set that up. And then the last thing you want to do is map screening questions, okay? And basically what this does is this will say for a particular type of clinic, you know, let's say adult clinic, influenza adult clinic, I only want certain questions asked as part of my question set that's going to go to the patient. And if you look down the left-hand side, out of all the questions that were available, okay, we're only selecting 6 questions, the one with the green check marks. So what's going to happen here is that when the patient goes to register, these are the only 6 questions for an adult flu clinic that will be asked. Now, these questions could change. You know, let's say you're doing a pediatric clinic, okay? Those questions might change. And if you see when I change this to pediatric clinic, the questions on the left, there's not 6 questions we're asking. There's only 3 questions we're asking, okay? So clinic and the type of service that you're providing in that clinic, the questions that you ask are specific to that service type. So again, you just want to review this to make sure that the questions that you're asking for that particular clinic are still appropriate. You're asking the right questions. If there's any additional questions you want to ask, you can just click on the check mark, right there. Instead of 3, I'm now 4. I'm going to click on Save and Update. Okay, now it's going to show me the questions that I've saved to that particular clinic. This happens to be the pediatric clinic. And it will also show me the order of the questions as well, too. You know, how do I want those questions answered, okay? And I can change the order. I can move stuff up or down by just clicking on the arrows here. And that will move the questions up or down, and then they'll be in the proper order that I want. Once you change the order, you click on Save, and then that question set to that particular clinic has been saved. So again, those are the typical housekeeping items that you want to go through first before we actually set up the clinic. So you want to just double check your managed clinic locations. You want to check your questions, what questions are available. You want to do your map vaccines, and then you want to also check what screening questions are attached to each individual service type. Okay? So those are the 4 housekeeping items that you want to do first. So at this point, I'm going to pause for a second in case anybody has any questions. No? Okay. Okay, so let's move on. Okay, so the next thing we want to do is now we're going to actually go in and we're going to create our clinics, okay? And the way you do that, again, under clinic management, we're going to go in here and we're going to, what we call add clinic schedule, okay? So we're going to click on this link, and what's going to happen is you're going to be presented with your clinic setup screen, okay? So the first thing we're going to do is we're going to pick the municipality that the clinic's going to be held in. In this case, I'm going to say we're going to pick Hackensack, okay? I'm going to say now for that municipality and zip code, these are all the different locations within that zip code that you can potentially have clinics. And if you remember before, we set up Hackensack Mall as one of the locations. This was a new location. So I'm going to select that from my list. Okay, so that's Hackensack Mall. We're going to give it a user-friendly name, clinic name, and this clinic name actually displays to the public, right? So I might say, you know, adult, I'll say Adult Flu Clinic, okay? Just a simple name, we'll just call it Adult Flu Clinic. In the clinic description, again, this will be available to the public to see. I'm going to give some additional description, right? So I'm going to say Adult Flu Clinic, and let's see, for adults 18 years and older. If you have Medicare, please bring your Medicare card, right? So again, I can type this description in there, whatever I want to type. And again, this is going to display to the public when they actually go in and actually register for their clinic. Again, you could type as much information in there. Even though the box looks like it's 2 lines, there is a scroll bar, so if I can continue to type. I could say, please arrive at your scheduled appointment time. Parking is limited. Right? So again, you could type anything you want in that description, and you can review it just by clicking on the scroll bars, right? And this is what's going to display to the public. Clinic type is fixed. It's immunization clinic, so you don't have to worry about that. But over to the right, these are the different types of services that you're going to be providing at this clinic, right? So I can say this is going to be a regular adult clinic. Okay, so I'm going to click on that check mark. And I might also do this as a pneumonia clinic as well, too, right? So here I might want to come back and I might want to change my description. Right? So I might just say this is adult flu and pneumonia clinic, okay? So I'm picking these 2 service types over here. If it was just a flu clinic, I can just make flu clinic. If we weren't doing pneumonia vaccine as well too, I could just pick that. If this was just a children's clinic, I can pick pediatric. Or if this was both, I can pick all. So these are all the different service types that you can pick from. But here, I'm just going to pick adult and pneumonia. Down below where it says number of patients expected, this is more informational for you. You can put in how many people you expect to have at this clinic. You know, if you expect to have 150, you can put that in. And then for lead time, if you want people to arrive so many minutes before their scheduled appointment time, you can actually put in a lead time. I will tell you that most people who run their clinics, they don't want people showing up early, so they just end up typically putting 0 minutes. Because they don't want people showing up early. Now, registration end date, there's the date and time there. By filling this information in, and I'm going to leave it blank for now, but by filling this information in, you can actually cut off the online registration at a particular date and time, right? So let's say I was going to run this clinic on August 30th, but I wanted people online to stop registering on the 29th at, let's say, 6 p.m. I can actually put in August 29th at 6 p.m. and then if somebody tried to register after that, that clinic wouldn't come up. Okay, so most people allow residents to schedule right up into the clinic time. They don't typically put in a registration end date. But again, that's up to you. If you wanted to stop online registrations at a particular date and time, you can actually do that by filling out that information. Now, the next line says appointment duration, and it says blank minutes. Now, the way this works is this is going to work in conjunction with the item to the right that says simultaneous appointments. And how this works is you're going to create time slots that the public's going to have available to them to pick. And typically what you want to do is your time slots could be any amount of minutes. 15 minutes seems to be the average time slot, but you can make 5-minute time slots, you can make 10-minute time slots, you can make 30-minute time slots. But basically when the patient is presented with a schedule, they're going to see time slots in the increments that you selected here. So here, I'm just going to put 15 minutes. So my time slots are going to be in 15-minute increments. Now, For that 15-minute increment, how many simultaneous appointments can I do within that 15 minutes? Well, obviously, this is going to be based on the resources of the nurses you have available to actually do those vaccines, okay? So if a nurse can typically do, let's say, 3 vaccines in a 15-minute period, and you have 3 nurses giving the vaccines, well, obviously, my simultaneous appointments are going to be 9. Now, what this does here is that on the schedule, once those 9 appointments are filled for a typical time slot, the next patient coming in to register will not be presented with that time slot. They won't be able to register for that same time slot. So what this does is this helps you with the flow of people coming into your clinics, right? So you're not bombarded all of a sudden by 100 people at the start of your clinic. If people go in and register and schedule times, then your clinics are more manageable and you have a better flow coming through your clinic. So that's what the appointment duration and the simultaneous appointments are used for. To the right of that, you have a checkbox that says private clinic. Now, the way private clinics work in the system is that if I click on this checkbox, this clinic will not be available for view on the public website, okay? It doesn't mean that people can't register. What we then give you the ability to do is send out a separate web address, okay, to this private clinic. And I'll tell you how private clinics happen. Let's take Burlington County. Let's say you want to run a clinic for all your county employees on a particular day, okay? Well, you can set up this clinic here, and you can mark it as a private clinic, okay? Then you could take the URL, the registration URL, and have, let's say, HR send it out to all county employees to go in and register. But by marking this clinic as private, it does not display out on the public site as a public clinic. It's private, right? So they'll never even see it being displayed, and you'll have nobody show up, at that particular clinic. So that's what you would use a private clinic for. And I'll come back. We'll create another clinic, and I'll show you how to do that in a couple seconds. Age restriction, okay? You can put in an age restriction on who can register for a clinic. Now, we said this is an adult clinic, right? So I'm going to say my minimum age is going to be 18, and maximum, I'm just going to put 99 for right now. But you could go 9999 if you want. And then the comments field here is your internal comments. If you want to put any internal comments and track them, you can put them in there as well, too. So again, that's the top section there of that form. We move down to the next line, which is my date of my clinic, my start date of my clinic, right? So I'm going to say this clinic we're going to have on August 30th, right? And the clinic is going to run from 9 a.m. through 3 p.m. Okay, that's going to be my clinic times, 9 to 3. We could see down below, here's the 2 vaccines that came in based on the clinic type, right, that I selected, right, because I selected both an adult clinic and a pneumonia clinic. So these are the 2 types of vaccines we're going to be supplying there. I'm not going to list the lot numbers right now. That could be done later, just prior to the clinic. But you can leave them as in the select status right now, and I'll show you later on what we do. And then some of this other stuff I'll explain later on when we come back as well, too. I can also add resources of who's going to work this clinic, right? So if I click on the Add Resource button, I can say that I'm going to have Jane Smith there working the clinic, right? And she's going to be there on the 30th. And she's going to work from 8:30 a.m. And let's say she's only going to go to 12 o'clock, right? And then I can add another person, and I can say this is going to be Bob Williams. Okay. Same thing, 8:30, 2014. Bob's going to be there from 8:30, but he's going to stay all the way to the end of the clinic and clean up. He's going to be there till 3:30. And again, I can keep adding all the different people that's going to be part of this clinic. And let's say Mary's going to come in at 12, and she's going to stay to 3:30 as well too. Okay. So I can list all the different resources that are going to be involved or work in that clinic. Down below, we show you the questions that were part of that question set that we had originally set up under, the map screening questions. But again, after you come in here and you see the questions, if you don't want a particular question, you can actually delete it, or you can click on Add New, and you can add questions. And it would only be to this clinic only. So any changes you make in here by deleting a question or adding a new question doesn't affect the question set for that clinic type or that that service type. It's only affecting this clinic and this clinic only. Okay. So now that I filled everything out, I looked at my question set. I said, you know what? Everything looks fine with my questions. What I'm going to do now is I'm going to click on Save at the bottom of the screen. Okay, what we should get up at the top is it says now clinic schedule updated successfully, okay, which means we've created this clinic. But now if you look over at my status field over to the right, it says planned, okay? And planned means that we're in a plan stage. We haven't opened the clinic yet for the public to view that. We're still planning these clinics, right? So I can continue to make changes to these clinics. Down below at the very bottom of the screen, we already clicked on the Save button. Let's say I'm going to have other clinics that are basically identical to this or even something similar. Well, instead of me having to re-enter all this information all over again, okay, I can just do copy clinic, right? And when I do copy clinic, what's going to happen is the system's now going to prompt me, right, for my new clinic, okay? All I'm going to do now is just pick my new date, right? So we're going to say this clinic is going to be done on, let's say, Saturday the 6th. And I'm going to say this is going to be the same time, or we'll say this only goes to 12 noon, right? This is only going to be 3 hours, right? I'm going to say that my resources are going to be different. Jane's not going to be working, so I'm going to click on the X and get rid of her. I'm going to say Mary's not working that day. Only Bob is working this clinic on that particular day. So what I'll do is I'll fill him in for the 6th, and I'll say he'll be there at 8:30. And he's going to stay to approximately 12:30, okay? And again, now I'll click on Save at the bottom, and now this clinic's saved. So if I wanted to now go in here and keep copying my clinics, I can do that. Now, what I would recommend is that you set up your initial clinic, and then basically you copy your clinics over for all your different locations that you have, and then have the ability to, you know, instead of having to fill out the screen for each one, just create a basic template type clinic, and then you can copy them over. Okay? If I wanted to delete a particular clinic, I can click on the delete button. I'm going to come back to the open in a second. You can delete a clinic. I can clear the whole screen. So let's say I want to start a brand new clinic, but I didn't want all these values here. I can click on Clear New Schedule, and everything will go away and clear, and then I can actually start a clinic. And then over to the right down at the bottom is a clinic URL. And I said earlier, if I had marked this clinic as private, this is where you actually get that specific web address so people can actually go and register just for this specific clinic. Now, you'll see two URLs down there. One happens to be a clinic URL, which means it's specific to this clinic, and one happens to be a location URL. And the difference for those URLs is that with the location one, if I send out that location URL, when somebody clicks on that, they're going to be presented with all clinics for this specific location. In this case, Hackensack Mall. Okay. Now, I think where this came into play a couple of years ago, especially down in Burlington County, Deanna at the time had set up multiple clinics at Burlington County College over the course of a month or two. Okay. I think there's about 5 different clinics. And what ended up happening was they took this location URL, and I guess somebody at the college ended up emailing that URL to all the students at the college. So when they clicked on the link, it presented them with all 5 clinics that were being held at the college, and then the student can go and pick whichever clinic they wanted. Where if I just sent the top URL, this URL is specific to this clinic and this clinic only, okay? So again, that's what the difference between the URLs are. One is clinic specific, and one is location specific. So again, just be aware of that when you send out your URLs. We also have the clinic setup report over here on the right. Okay. When I click on that, basically this is just a report, a form of information for this clinic that I set up. We'll just give it a second to launch. Sometimes the first time we do or we create a report, it does take a couple of seconds longer to launch the report. So we'll just give it a second. Here we go. And there you'll see the report that we have. It's basically just a summary of all the information that we entered in and so on and so forth. So that's your clinic setup report. Okay, back to these clinics. So we set up 2 clinics. They're both in what we call plan state. But let me show you how you come in and search your clinics first. If I go back to clinic management, I go to the 3rd item in the list where it says search clinics. Okay, I can search by a specific town. I can search by a specific clinic type, a date range, a radius, a status, plans open or closed, a type. But here I'm just going to pick and just hit search, and I'm going to bring up all my clinics, right? So there I see I have 3 clinics that are currently set up. Now 2 are in the plan stage, right? These are the 2 that I just did, and 1 is in open stage. Basically now, in order for the public to see my clinics, I would need to open them. Now, to show you what I mean by that, let me come over to the public site and go into schedule an appointment. I'm just going to put in my zip code here and hit search. And what the system's going to do is the system's only going to show me 1 clinic that comes up, right? Because I've only opened 1 clinic. But if I go back to these other 2 clinics, let me click on edit. And I'm going to click on Open Clinic at the bottom. It says Update the Clinic Status. Yep. Now my status says Open, right? So this clinic happens to be open. And now I go to my other planned clinic, and I say, you know what? I want to open that clinic as well, too. Now, since I've opened all my clinics, all 3 clinics are open, out on my public search site, if I now click Search, now what you'll see is you'll see all 3 clinics being displayed there and coming up, right? Now, typically here, the way we display these are, first thing we do is based on the zip code I entered in, we display them by distance, the closest ones first, and then we put them into date order, right? So now these all happen to be at the same place for the most part, but typically we display based on distance first and then based on date, okay? So we'll come back here when we select, but I just wanted to quickly show you that area right there. So again, we've set up our clinics, we've opened our clinics, now those clinics are open, the patients can actually go in and register. So again, from a clinic setup standpoint, that's how you actually go in and set up your clinics, okay? The other piece that I want to show you here that you'll need to know is inventory management, okay, as you get your flu vaccine in the door. Now, I don't know if you've gotten any flu vaccine yet or you're anticipating getting it very shortly, but as that flu vaccine comes in, what you're going to want to do is you're going to want to add that inventory to the system, because later on, just prior to us performing our clinics, we're going to need to associate the lot numbers, okay, with the clinic. So let's go in and add some inventory. So I'm going to go under Inventory Management. I'm going to click on Add New Inventory, okay. I'm going to say my vaccine name here happens to be, we'll just pick regular flu vaccine, okay. Now we'll take that one right there. We'll take the flu vaccine. We'll list what manufacturer you're buying it from. Okay, I'll say Novartis. CVX code, we just use 141, so you can kind of just use that one. Now here's where you're going to put your lot number. So I'm going to put in 2014. I'm going to put A165B, right? That's my lot number. I could put in the NDC code of the actual product, right? So I'm going to just put in 00069-123456. What's our vial type? How are we getting these in? Are they pre-filled syringe? Are they a multi-dose vial, single-dose vial? We'll say this is multi-dose. The date we received, let's say we received it today, August 15th. And what's my expiration date? Well, my expiration date might be 06/30/2015. Okay. How many doses? Now, you might get in, let's say you're using a multi-dose vial. There's 10 doses per vial, but let's say you get in 10 vials. Well, that's 100 doses, right? So you want to list how many actual doses you have. So in this case, I'm going to say we have 100 doses. My unit cost per dose is, let's say, $12.50, right? So a total of $1,250. Vaccine category, you can list, typically we list this as private because it's for private use. You can list where you store it. I could say in the back room. Supplier name, if you get this from a distributor or whatever, you can list the distributor, so, whoever you get it from, let's say you get it from McKesson, you can list that. Okay. And then any comments about this vaccine you can put in. So here I'm going to click on Save. I'm going to save that vaccine. I'm going to do New. I'm going to add New. I'm going to add some of my pneumococcal here. And we'll say this came from Merck. Lot number 2014-Z9765. And then 0089. Just keep entering in. We'll say this is a multi-dose. Well, we'll say this is a single-dose vial. Again, I received it today. Expiration is 6/30/2014. Let's say I got in 25 doses. Not 2014, 2015. My cost per dose is, let's say, $25.50. Vaccine category, again, is private. I'm not going to worry about the storage location and supplier's name, but I'm going to click Save at the bottom, and I'm going to save my details. Right? So now my inventory has been added. Now, with inventory, I can always check my inventory. I can always go to search inventory, right? I can take a look at the drugs that came in. I can search. I could sort these by expiration date, or whatever. Just quickly go in and take a look if I want to just look at specific pneumococcal, for example. Okay, I can see there's my pneumococcal that I just added right there, right? So tells me total doses 25, doses used. This is all zero right now because we haven't done anything. And here's what I should have is doses remaining, which is 25. Okay, and as we administer and update the records, this doses remaining will eventually go down, right? So hopefully it goes down to zero. So again, that quickly gives you an idea of your inventory, right? Quickly go in here and take a look. Right, so here's the one that I just added here, right? We have 100 doses available. So I just wanted to show you quickly. Now, you can also do inventory adjustments as well too. Let's say I needed to adjust an item, right? Let's say those 100 that I just got in, that was from Novartis, and this is the one I just got in today. Let's say I'm going to give this or transfer this, right? I'm going to say doses transferred. Right? Transaction date is going to be today the 15th. I'm going to say I'm going to give 10 doses. We're going to transfer that today again. And we're going to transfer that to, let's say, the Monmouth County Health Department. Okay. 1 East Main Street. Right. And reason for a transfer, whatever. Okay. Now, once I save this transaction, this inventory transaction, if I go back and search my inventory for this particular flu vaccine, okay, if we look at that one right here, this is the one that we're looking at. 100 doses originally received, but now you see in the transferred column, okay, there's 10 that's been transferred. Now my available doses remaining happen to be 90. So any transactions you do in this inventory transaction screen will be reflected there. So some of the transaction types, I did a transfer, but you could do doses have been spoiled, used, wasted. You can do a year-end adjustment. So at the end of the year, let's say you're left with so many doses, and you want to adjust the inventory back down to zero. You can do a year-end adjustment. If you return to vendor, you can track that as well too, or other. Okay, so anytime you do any changes in here, it's going to decrease from your inventory. So again, that's where you can go in and you can do your adjustments. Okay, so we've added some inventory. Let me go back to my clinics real quick. Let's go to search clinics. okay? And I'm going to pull up these two clinics that I just did. Now, since I've added my inventory, I can actually come in here now, right, and I can add my lot numbers, right? So I'll pick that lot number there for that. And for this one here, I'm going to pick that lot number, right? So I'm going to pick my lot numbers that we're going to be using at these clinics. I'm going to save that information. And once I save that information, now the system over under the report section is going to give me the ability to actually print my barcode labels that we're going to use for the consent forms or when we're doing our clinics, right? So these are labels, barcode labels for the lot number that will be printed out prior to the clinic. These go on Avery 5160, okay? So it's a sheet of 30, okay? But you'll take these labels with you, and as the nurses administer the vaccine, what they'll do is they'll take one of these labels and they'll put it on the consent form. Because what we do later on is at the end, after the clinic's over, we scan these forms into the system, and this is how the inventory gets reduced, okay? Because we read the barcode with the lot number on, and we show that that person was administered, and now what happens is we reduce your inventory by 1 dose each time we scan a barcode. So again, you're going to want to print those labels prior to the clinic. The other item we have on the reports as well too is a blank consent form, okay? Typically, before you go out to your clinic, what you want to do is you want to print some blank consent forms because you're always going to have walk-in people, okay, who come to your clinic. So for the walk-ins, basically, this is the section here on the form that we put the barcode label for the lot number. Each consent form will have a unique tracking number, okay, because again, that's how we track it in the system. But then the person can fill out the information here, their name, insurance, date of birth, address, contact, email. The nurse can ask them the questions that you typically ask at the clinic here, right? You can notate their responses. And then at the bottom, they actually sign off on that particular form down at the bottom, right? And after you do the administration, the nurse will check off the vaccination site and then take one of those barcode lot number labels and put it in this section right here within this box. Once that's done, later on, next day, within a week or whatever, these forms get scanned back into the system, and then that's what actually updates the patient record and also the inventory based on these barcodes that we have up here on the top of the form. So again, that's a couple of items that you need to do just prior to the clinic is print out your lot number labels and also print your manual consent forms. Okay, so let's go back to the public site here real quick, just to kind of show you that. Okay, so the public, and I believe the county has a link to this site out on the on your Burlington County website. But once they land on this page here, what the public would do is they would click on Schedule an Appointment. Okay, once they click on that, they can actually search for available clinics either by zip code or by town. Most people just put in their zip code. So I'll put in my zip code. I'm going to say any distance, but if they wanted to limit the distance, they can, okay, to anything. Or if they wanted to see just a clinic past a specific date, they can put in a date and it will only show clinics after that date. But here I'm just going to leave it open. I'm just going to say show me all clinics from 08820, my area code. Now the system's displaying 3 clinics, right? So I see one here at the Hackensack Health Department. I see one at the Hackensack Mall. I see another at the Hackensack Mall. I see that this one is really, it looks like it's an adult clinic and it says minimum age 18, max 99. This one gives me a little bit more information in detail. This is the description that I entered in. So adult flu clinic for adults 18 years and older. If you have Medicare, please bring your Medicare card. Please arrive at your scheduled appointment time. Parking is limited. And I can go down here and I see this one as well too. Now, if I'm not familiar with the area where this is, right, the mall's pretty easy, but if I'm not familiar where Hackensack Health Department is, I can click on the map and the system's going to display Google Map of exactly where that clinic is located. Okay, we'll give it a second for the map to launch here, right? So we see exactly on the map where it's located. And then if I want over on the left-hand side here, okay, why is this not cooperating with me right now? Okay, this map screen is not cooperating, but I could put in my address here and get directions exactly right to that location. So right now, this is not displaying for me. I'll have to take a look at that. But I can get directions. If I put my starting address here and get directions, it will actually give me directions, and then I can print out those directions exactly where I'm going. This is Google Maps, so it's something probably with Google Maps that's not working correctly here, but we'll take a look at that. But they can get directions to that clinic. Give me 1 second here. Okay, so now I'm back to my clinic. So let me say I want this middle clinic here. This is the one I want to register for. This is the one on 8:30 from 9 to 3. I checked my schedule. I'm good to go. I'm going to click on the register button. Okay. Now, what I'm presented with here is I'm presented with all the time slots that are available. Now, if a time slot is in green, it means that there's appointments available. Once a time slot gets filled up with all appointments that you can handle for that time slot, it becomes gray, and that person will not be able to register for that time slot, okay? So again, I'm listing all the time slots. So I checked my calendar. I said, you know what, I'm good for 10:30 a.m. And when I click on that, it's going to change it to red temporarily, right? And at the bottom, it's going to say, okay, 8:30 at 10:30. I mean, that's the appointment information I want. Now I can click on, if I click on, well, you know what, nah, 10:30, I want 10:45 instead, right? I can just click on that, and it makes it red. Here, I can then click on Save and Continue. Now it's going to ask me to go in and register for this clinic. Now, the first thing we're going to ask is, because we're offering 2 different types of vaccines at this clinic, both a flu vaccine and a pneumonia vaccine, which one do you want to have? Well, I mean, I'm young. I don't need a pneumonia vaccine. I'm just going to pick flu vaccine, right? We display the clinic information, the date and time, appointment information. Now I'm going to go in and I'm going to put my information in, and I'm going to, you know, set up my appointment. So I'm going to put in my first name. I'm not going to use mine because I'm already set up here. So I'll pick somebody else that we can use here. So I'll say Stephen Jones. Last 4 digits of my social. My date of birth I'll put in here is 10/31/1965. Mail. My address is 16 Pearl Street. Option. Phone number. And my email address. Insurance type, again, if you take an insurance, they can list it. I'm just going to do none for right now. I don't have insurance. And then here's the question set that's being presented to the individual, okay? So they'll have to answer these questions. So is the person being vaccinated sick today? No. Is the person being vaccinated younger than 2 years old or older than 49 years old? No. Does the person being vaccinated long-term, right? So I can go through here and I can just quickly answer these questions, right? These are the ones that were selected for me, okay? At this point in time, after I ask my questions, I'm going to click on Save and Continue. Okay. Now what we're doing is we're presenting them with your consent information here, plus we're also showing them the VIS as well too. And again, we have to update for this year's current VIS. But again, if they wanted to print out the VIS, they can actually print it out if need be. But the VIS is available to them right here. Okay. I'm going to now electronically say I agree to everything. I'm going to electronically sign this form. I'm going to say Stephen Jones. I'm doing this for myself. Today's date. I'm going to click on Continue. Okay. And then it's going to ask me just to review everything that I've entered in. If everything looks okay that I've entered, I'm now going to click on Submit. And now it's going to tell me registration form has been submitted successfully. An email confirmation has been sent to the email address provided, my email address that I put in. It shows me all the information here. I can do the map feature again, okay, if I didn't do it the first time, right? I have the map feature available there. And then we ask them to print their consent form, right? So here they'll click on Print Consent Form. We'll have that come up. I'll show you what the consent form looks like. Right, so there's the consent form filled out for me, right? So all my information is already filled in on the consent form, plus how I answered the questions, okay? Now you can go in, and when they come to the clinic, because this is going to be most likely, days or weeks before that they register, you're going to re-verify, the nurse is going to re-verify the questions or their responses to the questions, and that's what the verification area is here. They'll just check them off, right? It's been electronically signed at the bottom. We also provide them with the VIS statement as well, too, here as part of that form, right, so they get a copy of that VIS. And the good thing is, too, is let me just log into my email here, and then I can show you real quick. If I go into my email, I should have an email right here. Here we go. I have an email here, right, of my appointment confirmation. So we send that automatically once they register. I also have a link here to the VIS as well too, so they can get to it. And then here's a copy of their consent form also in the email as well too. So if they forgot to print their consent form on this screen here, we also send it to them in an email as well too. Now at this point, they can click on register a new patient or whatever at this point. But for the most part, they're done at this point in time, okay? They're registered, they're ready to go. Now, 36 hours prior to the appointment, we will send them a reminder email, okay? The reminder email, again, will contain the consent form, so they know to print that out and bring that with them to the clinic or whatever, right? Because what happens is if they have that consent form already filled out, we want to put them in the, I want to call it the easy pass lane, right? They already did everything. They registered online. They have their form. You're just going to verify. The nurse is just going to re-verify their questions, and they're basically just going to go get their vaccine, right? They're going to kind of bypass everybody who just are walk-ins and filling out forms and all that stuff. You want the people who did this online and have their forms available to quickly go in and just get their vaccine. So, again, encouraging people to sign up online is a good thing because you can let them know that they can be in and out of the clinic quicker than if they come in as a walk-in. Okay, so again, just wanted to show you that that feature is there. What else? I'm not going to get so much into it today, but I'll just show you a couple other things. So typically what would happen is, at the clinic, I mentioned this before, we're going to put the lot number label on here. But typically what happens after the clinic is over with, you're going to have all your consent forms, okay? And with those consent forms are going to get scanned back into the system. And when they get scanned into the system, a couple of things happen. One is the inventory gets updated, right? So every time we read that barcode with that lot number on, we're going to reduce the inventory by 1 dose. And then what we're also going to do is we're going to read the patient barcode, and we're going to update their record to say that they've been administered. Now, if I go in here, let's take a look here. What happened to my screen here? Let's do this. Log out. A long week. My typing's getting lazy at the week. Okay, so if I log in here at the end, let me just pull up my employee record. I'm just going to do a patient search for Jones. Right? So there we are, Stephen Jones. Okay, if I click on the checkbox and I click on Edit Patients, what we'll see is we'll see information that we've entered in as part of the registration. Over here under Other Patient Info, we have some additional information. Under the Appointments tab, right, we're going to see my appointment that's been scheduled. Okay, so I have my appointment there. Let me just write down my tracking number, 201-421-00257. Okay. I can see that I have an appointment scheduled. Now, they might call you and say, you know what, I want to change my appointment. Well, you can come in here and you can change it, but the user can also change their appointment. If they're back out on this public health site where it says change existing appointment, if I come in here, I would put in there the tracking number, and this tracking number gets emailed to them as part of their setup. Right, so I'll put in my tracking number, and then I'll put in my birth date and hit search, and my appointment should come up. And at this point in time, I could do a couple of things. I could update my appointment date and time. Okay, maybe let's say I can't make it on the 30th. I want to check to see if there's another clinic. I can change my date and time to a new clinic. I can update just my appointment time. Let's say the 30th is still good for me, but I can't make it at 10:45. I want to come a little bit later. If the spots are available, I can go in and update my appointment time, or I can cancel my appointment altogether, right? So as the user, I have this ability to do, all these tasks here. Cancel, update the appointment time, or update the time, the date and the time as well too. So those are all available, to the user. But again, you could do that as well too. You can come in here and you can actually update their information. Immunization history will be, again, as we get administered, this information will be updated. Right now they're in the status of scheduled, but once they're administered, this will go from scheduled to administered. We'll show the doses, the lot number, the manufacturer, who was administered by, and so on and so forth. So then that record gets updated. You'll also be able to view their screening history questions as well too, okay, within the system. And then the documents tab is where you actually see a copy of their scanned consent form. So as we scan those consent forms back into the system, we also keep a record within the patient's file as well too. Let me go back and see if I have any here. Let's go here. I want to look at, let's see. I want to see appointment search. I want to see if I have anybody who's been administered. To see if I have a copy of their form. Administered. I just want people who are administered. Okay, so here you go. Here's a patient who was administered, right? And if I go to the Documents tab, what we should see here is we should see a copy of their consent form come up. Just give this a second here. Again, I'm working in the test system, so I don't know if some of this stuff is valid. Let's try another patient here. Okay, it looks like I'm not displaying the forms right now. Again, I'm in the test system, so I'm not sure if this is accurate data or not. But let me go back to appointment information, right? So once a person gets administered, their status goes to completed, and then their immunization history here. Remember I said gets updated from being scheduled to administered. One dose, this is the lot number, and this is the manufacturer of that particular lot. So again, we have that information in the system. We also have the ability, or you have the ability, to add an immunization record on demand by clicking the Add Immunization button. So if they had some type of other immunizations that you want to track, you can actually add them to the system. But then people always ask, well, they say, Mark, what happens for people who don't register online, that call us and want to get registered? Well, you can always come into the system, and under patient management, you can always select on Add Patients, okay? And you can add a patient yourself to the system, okay? So if they can't register online, they're unwilling, maybe they're older and they don't know how to use a computer, you can always come in here and you can actually add them to the system as well too. Plus they also get added at the bulk scan time when we scan the consent forms in. Because if you remember, I said that you're going to print blank consent forms and take them to the clinic with you. At that point in time, those people who manually fill out the form, those people will have to be set up. But that's done at the scanning time, at the scanning process time, not here. But again, that can be done as well too within the system. So that's pretty much it for overall. Like I said, you can always come in and here search a patient. You can search appointments. That's all available too. But the main function is the clinic setup and the inventory, adding the inventory, initially to get started. The scanning of the forms and everything comes after the fact, after the clinic has been completed, and then at that time we can kind of go over those items as well too. So I'm going to open up to any questions if you have any questions.
Mark, I don't believe there's any questions at this point. It was a very thorough presentation, and there's a lot of features that were included there, so we thank you for that.
Sure, no problem. Yeah, so what I'll do is, like I said, I recorded the session. What I will do is I need to convert the recording. We do have a YouTube site. What we could do is I can post this up on the YouTube link, and I'll send you the link. So anybody else that wants to go through this, they can just click on the link and they can kind of review the section.
Yes, sir. Thank you. That would be very beneficial if we could email that to Frank, and that way we could, look at the video whenever we need to.
Okay. Okay. So when are you anticipating your first clinic to start?
September 15th is the first clinic.
Okay. Okay. And did you get your flu vaccine yet, or are you still expecting it?
We're still expecting that. But we do have pneumo. We do have pneumo.
You do have pneumo? Okay. Okay. Well, whoever's going to be, setting up these clinics, when they go to start to do their first clinic, if they want to walk through the first one or two with me, I'm more than happy to do that. We could set up a remote session, and I can watch them, do the first couple of clinics to make sure, that everything goes okay.
Oh, that's great, Mark. That could be very beneficial. Thank you.
Okay, sure, no problem. So, but yeah, like I said, there is a lot in the system. I know it's hard to kind of cover everything in one shot, and having the recording, people can kind of go back and go over the recording again and just get a feel for it a second time or a third time. But like I said, I'm always available. If somebody's running into an issue or a problem or whatever, we can go from there. So.
Yes, Mark, thank you very much for your time. This was very informative, and we look forward to speaking with you again in the future.
Okay, good. So if anybody doesn't have any other questions, I'm fine for today. I'm good. I'm done. But like I said, if you do come up with a question after the fact, Frank has my email. You can just email me, and I'll respond back that way as well, too.
Yes, sir. Thank you very much for your time.
Okay, very good. You guys have a great day.
Thank you. Have a great day. Have a great weekend.
Okay, thanks. Take care. Bye.
Take care.